A groundbreaking Oz. You don't have to live in agony anymore. Heal your chronic pain. No pills, no surgery.
Today, we are changing the practice of medicine.
The new invisible treatment your doctor hasn't heard of.
It builds a magnetic field around you, going deep into your body.
Is this the revolutionary cure you've been waiting for?
Are these things for real?
This is new cutting-edge research.
Dr. Oz investigates.
This is how we're going to change medicine together. Thank you very much. I am more excited about this show than any other we have done this season, because today we are changing the practice of medicine, and you get to help. Now, if you've tried everything to ease your back pain, your neck pain, foot pain, arthritis pain, then this is the show for you. There's a revolutionary cure for pain that few doctors know about, because it's not a new pill or surgery. It uses moving magnets, energy waves that change the way your body copes with pain. Wait till you see what we found. You may not realize it, and you certainly can't feel it, but inside each of us is a raging electrical storm. A biological whirlwind that controls every cell, every nerve, every muscle, every thought. How you experience pleasure, and even how you experience pain. What if you could harness this powerful force field inside of you to feel better, sleep longer, and most miraculous of all, ease your chronic aches and pains? The FDA has already cleared pulsed magnetic therapy for fusing broken bones, treating severe untreatable depression, and now to treat postoperative pain and swelling. It sounds like science fiction, but is magnetic therapy for real? Are we finally on the brink of a whole new frontier to reduce, even erase, your pain? Now, just to be clear, we are not talking about static magnets like the kind you stick on the fridge. This is pulsed electromagnetic fields. It's pulsing, moving energy, much more powerful than static magnets. So here's how it could work for your pain. All right, so this is really important. I want you to understand it well. Here's what researchers say magnetic fields are doing inside the body. Inside this mat, there are electrical coils. And when electricity passes through there, it creates a magnetic field that moves through the body. And it whispers. There's 75 trillion cells in your body. And it goes deep into your body, places where sports screens and heating pads could never reach. For example, down around the spine, where that red, angry area is. Now, the magnetic field turns on, and when it does it, it activates these ions, these charged particles. And there are proteins in there, and there's signals in there, stirs these things up. And these charged particles bring in nutrients, but they also begin to influence things like blood supply. Now, when the blood vessels are going in here, the red blood cells are actually stacked. See, they're stacked like that? They're not supposed to be stacked. When they're irritated, that happens. So when you pass magnetic fields through there, that yellow line, it opens up the blood vessel. It breaks apart these red cells. They're not stacked like coins. So you can get deep healing, better oxygen supply, so the healing process takes place. You don't just feel better, you are better. And that's an important advance for us. One that we haven't been really practicing until today, because today we're going to change that. So Dr. James Dillard is a world-class pain specialist who practiced with me at New York Presbyterian Hospital for many years. So Dr. Dillard, are these things for real? I mean, how can magnetic therapies help ease pain?
Because the electromagnets actually affect the nerve cells. Nerve cells are electrical cells, and the magnetic fields can actually affect how the nerves fire and quiet them down without using drugs that most people are used to, and increase circulation in the area and aid the healing. Many of my patients want to try something other than drugs, unnecessary surgeries, damaging surgeries, and these deep injections. So a lot of patients, I don't actually have to convince them. They want to try something else.
Okay, so this is Jeannie, and she's been in our office for about the last couple months, is that correct? Mm-hmm. Okay, and Jeannie, for everybody that's watching this video, would you kind of just explain some of the things that brought you into our office?
Yes, I had no feeling from my elbows to the tips of my fingers, it's neuropathy, and from my knees to the tips of my toes.
Okay.
And I had balance issues, I would get up, I'd fall.
Okay.
Going down steps was almost impossible.
Okay.
I had to have someone help me.
Okay, and how did those, the loss of feeling in your hands and your toes and your loss of balance, how did that affect your life?
Oh, it was very hard. My husband had to almost dress me.
Okay.
And there were so many things I couldn't do. I couldn't turn the pages of a magazine. I couldn't feel it.
Okay.
I couldn't use a computer, so that affected my work. just multiple things. I couldn't put on my jewelry. My husband had to do that.
Okay, and ever since you've been coming into the office, what has changed in your life ever since you've been getting care in our office?
This is what's amazing. I can turn the pages of a magazine. I can use a computer. I can cut up vegetables. I couldn't even feel the vegetable before. Now I know where it is.
Okay.
I can put on jewelry. I can put on all of my own makeup.
Excellent.
I can fasten my clothes. It's just been amazing to me the things I can do.
Excellent.
It has even affected my mind. I would read and I'd have to reread and reread and reread. I don't have to do that anymore.
Okay.
And I've been able to memorize scripture,
Excellent.
8 verses just recently.
Excellent.
So my mind's starting to come back too. So all of this is working together. It's just exciting.
And with some of the other places that you received care, what was the prognosis that they gave you?
Oh, they told me there's nothing they could do. There's not to even try to find help. I didn't believe them.
So regaining your balance and feeling your fingertips and toes is just something that you never thought you were ever going to regain your life ever again?
I thought that I was going to be semi-invalid.
Sounds like, with the care you've received here, you've been able to do some things that you never thought you were ever going to be able to do, and you're starting to regain your life back. That's excellent.
Yeah, it's like a miracle to
Excellent.
me.
What was your problem?
Well, I started with drop foot, then I got acupuncture pain, or not acupuncture, neuropathy pain for, I'm going to say about 5 years.
Wow.
And it got worse and worse.
And you've been tried other treatments before coming here?
I've tried acupuncture, I've tried dry needle, I've tried massage. Massage helped a little bit, but not significantly. And the other two helped for a while, but then didn't help anymore. And I've tried the standard pill, gabapentin, and its efficiency wears off after a while, so it's no good either.
Gotcha. Now, when you say neuropathy, is it like numbness, tingling, burning?
No, leg pain.
Leg pain.
Aches.
Aches.
Sharp aches.
Gotcha.
Wake you up at night aches.
Gotcha. Gotcha. And so, what have you been doing since you've been coming in here?
Well, I started in here, I don't know, 6 or 8 weeks ago, and after 2 to 3 week treatment, I don't have neuropathy pain anymore.
Okay, and you're using that PEMF, the magnetic therapy?
PEMF,
Awesome.
exactly right.
Awesome. And so, doing a little bit better at night?
I don't wake up with pain at night. I wake up to go to the bathroom, but not with any pain. It wakes me up, and then I have to put Voltaren on it, and that would treat it for a couple hours, then you wake up again. All that has totally disappeared, like a miracle.
Wow. Well, there's a lot of people out there that have neuropathy. Thank you for doing this video. We're just going to share it with them so they can know that there's something else out there besides what they're doing.
They need to know, because it's miraculous. It really is.